Okay, thank you, Hindi team. Now we are moving to English session. Today is our 1981st day of continuous webinar. Before beginning the session, we'll have a prayer, silent prayer. Good evening and welcome once again. Thank you all the participants for joining with us. Today is our 1981st day of continuous webinar. Today's our guest is Rodrigo Venticinque from Brazil. He is international speaker in integrated health and dentistry, and he's the president of Brazilian Institute of Integrated Health. And I'm very happy to welcome you, Dr. Venticinque Rodrigo, for today's webinar. You are most welcome. Please.
Hello, it's a great.
Doctor asked. Okay.
Can you hear me?
Yes, sure.
I'd like to thank you very much for the invitation, and I'm very happy to be here with you, with all of you. I'm going just to place my lecture here. Okay. Sometimes I have some problems here with the videos, but please let me know, okay? Can you see my PowerPoint? Hello? Perdi a conexão. Hi, hello. Can you hear me? Okay.
Yes, sir.
So I'd like to thank again for this opportunity to share what we've been studying for many years. So I'm going to. Can you see the presentation, the PowerPoint?
Yes.
Okay.
But I think
So,
I can hear you, but can you make the sound a little louder?
You cannot hear me.
I can hear you, but if you increase the sound means that will be more. Otherwise, it is clear. I can hear you.
I'm going to try to speak louder, okay?
Yeah.
Okay. So let's make here again. Okay. So my name is Rodrigo Venticinque. My surname is Italian, but my family and me, we are from Brazil. I was born here. My father, my mother, my two sisters, we are dentists. My great-grandmother, aunt, and also a cousin are dentists. So we see dentistry as a mission, spiritual mission to serve people. And we've been studying pretty much about dentistry. And now I'd like to share with you what we've been doing. So in my graduation, that was 33 years ago, I think the most important thing it is that I'm fellow from International Academy of Oral Medicine Toxicology. I'm accredited as a biological dentist. I'm also the first dentist in RECODE, Reverse Cognitive Decline in Alzheimer's, that it is a program in the United States, both of them. And I've been lecturing in Brazil, all over Europe, States, and we are being publishing, researching about how mouth can affect our systemic health. Okay, so just to let know our thought about integrative, we have here structure where the dentists are working, but we must see the patient with a view, special view, with a chemical organic view, like the warming, detoxification. We need to have the patient to send them to nutrition. We need to see the biophysics, so the communication from the brain to our cells and to our organs are very important. Emotional questions, emotional emotional issues are very important too, because they can change everything. So when we have fear, hate, we prepare our body for flight or fight and flight. Our sympathetic systemic is achieved, and all these will have in our muscles a response. These can provoke in our teeth and also our spine, like discus hernias. So every time we change something, we can also change the other systems. And I'm going to talk a little bit more about that very soon, okay? So tooth, they can be interference fields because they can cause irritation. They can be also a house for bacteria, virus, toxins, galvanic chain. Galvanic chain, it is the difference of potential of different metals in our mouth. So amalgams, fillings, crowns, titanium implants, and other things, they can change electrons, and these can be also a field, okay, interference field. So endocarditis and bacteria, they can grow up in our teeth and go for our blood and cause many problems. The tooth, you know, they are linked to all our body because we have a lot of nerves inside, and it goes straight to our brain into our body. I'm going to show to you how this happens by the embryogenesis. So when we have the ectoderm, endoderm, and mesoderm making our teeth, they are also doing our organs. And there is a link here, electrical link, that it can originate in the same tissue. So the nerve, the central nervous system, the tooth acts as a direct extension of the brain. So when we have interference fields in our tooth, these might also have a problem in our brain. Like that, the tooth is like an electrical beacon. It's easy to understand when we have here this picture. Can you see this picture, everybody? Is it okay? Okay. So we have here a lot of nerves, and all the information coming from our brain, it goes by neurons, and also it goes by meridians. So those information coming from the teeth are in the middle of the way for the organs. Here we have a synapse and a neuron. And when we have here a biochemical, a neurotransmitter or hormone, it will be transformed in electrons. And those electrons, it will transport information. We call bioelectricity. This is the way our cells communicate with each other. So it's easy to understand that information from our brain passes through our tooth and goes to all our organs. And also, it goes in a fast way by our meridians. And those meridians, we can see here, there are a lot in our face. When we have interference fields on our teeth, they might stop or delay the information to our organs. When we remove the third molar, the wisdom molar, regularly we can have a bone cavitation. It's something that a kind of disease, it happens in our bone, and I'm going to show very soon about that. But when we don't have the correct information to our small intestine, maybe we are not absorbing the micronutrients. They are very important to make the molecular, to hormones, enzymes, vitamins, amino acids. So if we don't have the right information, we cannot make the molecule, and our body begins to decrease. Is it okay? Does it make sense for you? Okay. So besides the communication between brain and body, we also have inflammatory factors, like in periodontology, gingivitis, endodontics, the problems inside the root, bone cavitations that I'm going to show to you what is it, and caries of cavities, okay? We also have toxical factors, amalgam, fluoride, BPS composites, and galvanic chain that I told already. So amalgams, they will release mercury that is very bad for our systemic. Fluoride, 100 and 100, there are thousands of articles showing why it's very bad, and I'm going to show here too. BPS composites, they are going to imbalance our hormonal system. And galvanic, it's the difference of potential, electrical potential between different metals in our mouth. We also have structural factors like apnea and snoring. It's very bad to the people who are sleeping beside us and for us. Because when we have apnea, when we are in the middle of our sleep and we have the REM sleep, okay, the REM dream, where our memories are the files are putting inside our brain, and it's very important for our memory. When we have apnea, our sympathetic system begins to be achieved. So bruxism is very bad. It's the movement, but we also have the clenching. When we clench the teeth, and we might have a problem in our periodontal ligaments, causing a problem, a chronic problem, periodontitis. Dysfunction of temporomandibular is very bad too, because we might have here a noise in our ear, beginning deaf, pain our neck, head, with our bone, our teeth, so it's very bad too. So all of these structural problems can be very harmful to our body. This is a video that I show to my patients to make them understand easily what is biological dentistry and how important it is. So the subtitle, it is in English, okay? I'm going to show to you. Can you see the video? Hi, hello. I'd like just to know if you can see the video, because I have some problems when I show in my PowerPoint. Can you see? So it's very important. Prevention. Prevention is the best way of everything. It's cheaper, more comfortable, easier. So it's very important we work with prevention and work with visual, sensitive, and also hearing is very important because every patient responds in a different way. The importance of integrated team, it is to have a better result to our patients and long-lasting. Because if a patient comes to me to make a rehabilitation, it's important to understand the root of the problem of him. Why he had this problem? Why he wastes all his teeth? Because if I can make the rehabilitation, giving back all the bite and the teeth, if I don't work in the root, probably they'll have the same problem in the future. So sending to a nutritionist, to a therapist, to a physician, it's very important to have a long-lasting result, better and long-lasting result. Here, it is the place we love to live. Peace, diet, nutrition, cleaning. So sometimes when we are in a war, we go to the other side. And this happens with the cytokines. Whenever we have some disorder here, infection, inflammatory disorder, galvanic chain, or everything, you know, this might have information to our brain saying we are in a war and we might have a problem here. So everything is very connected. It's important to avoid this war here by gingivitis, periodontitis, caries, bone cavitations, etc. I'm going to show to you, okay? So who will bring us from the one side to other side is going to be the cytokines. Cytokines, I took only one, but there are 1,000, okay? And this one, EL6, it might affect microcirculation. This is very important for me because the concept of microcirculation, micronutrition, oxygenation, and brain oxygenation, and cleaning of our grounding, our biological terrain, it's very important because this factor here. So when we have EL6, it's going to be very bad, and our mouth have a lot places to have this here. TCL5 ranked, it's another one very linked to NICO, bone cavitations and neurology. I'm going to show to you, but NICO means neurologia induced by bone cavity, osteonecrotic bone cavitation, okay? I'm going to show to you. So one of the defense that our body make is free radicals. Those free radicals, they will kill the pathogens, but it will also kill our cells in a long term. Another defense that our body makes is vasoconstriction. Vasoconstriction, which will decrease the number of toxins and bacteria in our brain. But in the same way, it will decrease the vasocirculation, the microcirculation, the micronutrition, and the cleaning. It will also make our heart have more efforts to pump the blood. Another way of defense, it is here we have pieces of bacteria, proteins of bacteria making a periodontitis, And this inflammation, this systemic inflammation, will wake up our macrophages, and with cytokines, it will achieve our microglia. And the microglia will prepare for the war, preparing, accumulating beta alpha lipoic. It will make weak the protein tau, and all of this is going to drive us for a cognitive death. So dementia, Alzheimer, Parkinson, and other disease. This is the microcirculation that I told you. So this is a rollo effect caused for three reasons, in my opinion, okay? The first one, it is the cytokines and fibrogen and plasmatic proteins in our blood that will make as a defense of our body. The second one, it is the metals. So when we have the metals, when we have the metals like the cations, okay, they are positive and they are going to link to the negative, and they are going to attract. So, and the third one is like we have iron in our blood to transport the oxygen, and here we have electromagnetic field. When we place here, we begin to agglomerate our blood. Once the blood is agglomerated, it's very difficult to be filtered in our liver, in our kidneys, and with the time, our blood is going to be more toxic and more acid. So what we want, it's like this blood here. So this is a dark field microscopy. And when we remove the bone cavitation, the blood like that goes for this one. When we remove the dysbiosis of our intestine, we also reach this one. When we take the electromagnetic fields and when we make the detoxification, we have this one. Very easy to bring oxygen, micronutrients for more connections in our brain, and especially to clean, because they are going to remove the dirty of our cells, our body, okay? When we have the rollo effect or agglomeration, we reduced tissue oxygenation, increased chronic inflammation, cardiovascular complications, increased risk of thrombosis, impact on cognitive function. So all of these are in the literature. When in a war, all the vitamins, hormones, neurotransmitters are taking care of this war. So sometimes we are fatigued, moody, not sleeping bad, you know, but we are achieving our sympathetic system. When we do that, the cortisol begins to deposit fat in our body. So when we remove the inflammatory factors, usually we can get thinner easily. This is also important to our health. So gingivitis, periodontitis, root canals, cavities, bone cavitations, they will generate inflammatory factors. They will generate fibrogen. It will increase the CRP, homocysteine, and interleukins, especially TNF alpha, okay? In the literature and the science, we have thousands and thousands of articles about chronic disease, hypertension, diabetes mellitus, arthritis, inflammatory bowel disease, and cancer and Alzheimer. And so it's very, very important to take care. And the best way, again, it is the prevention. Going to the dentist who can teach you how to do it, the best toothbrush, the best toothpaste. It's very important because when we do that, we are preventing many kinds of disease. All we have here a big root anatomy difference. So here we have the root and the nerve, and when we cannot remove properly this necrotic tissue, this might feed many bacteria, viruses, and fungus, making a chronic problem. Even though the dentist is very good working with a microscope, working with a laser, with colloidal silver, ozone, sometimes it's impossible to clean up everything. And this will be an inflammatory infection, releasing inflammatory factors. And those will achieve the war and the defenses. So here we have the periodontal ligament, and when we clinch, we break this ligament, and with the time we make an inflammation, a chronic inflammation here. So when we have this pain here, we achieve our sympathetic system, and again our fight and flight system. So here, the literature shows to us that there are a lot of Epstein-Barr virus. Epstein-Barr virus are related in many articles, especially in periapical. So apsy is here, periapical disease are here, okay? And this part, we have here the cytokines. Why Epstein-Barr is so bad for our health? Because it may change our RNA and DNA, and it's related to arthritis, rheumatoid, cancer, syndrome Sjögren, and many other diseases. To remove the tooth, it's very important to clean up and to use the platelet-rich fibrin. So it's from the blood. We use the centrifuge, and we collect the soldiers and the fibrins and put inside the place. We clean with ozone, with erbium IAG laser. We put here as a band-aid, biological band-aid. And with this care, taking care before with a physician or nutritionist, a therapist, so we can have a better result. So this is the part of PRF. When we don't do that, we might have this bone cavitation and neurology induced by osteonecrotic bone. So whenever the X-ray goes through to the film, this means it's soft. So this part in black, it's soft. This part in white, it's hard because it couldn't go through. When we open that, we can see a cavitation, a cave where many bacteria, virus, fungus can survive here. And to protect our body, a soldier of us comes here. And this soldier it is the CCL5. The CCL5, there is a great work from Lechner. It's a German professor, very famous, and he has more than 2,000 cases where he removed from here and sent to a lab to evaluate. And he saw CCL5 very high here. So he begins to study that and research about that and saw a number of studies related to allergy, more than 9,000 articles relating CCL5 that he saw very high in the bone cavitations, and reviews of cancer, rheumatic arthritis, breast cancer, Alzheimer, depression. So sometimes the patient goes to the psychologist or psychiatry, and he has depression. But if he's seen in a multidisciplinary view, he could heal even fast, because sometimes they might have a problem in his mouth, like a thyroid, Alzheimer, and cancer, especially cancers. It's very important to see the mouth. Fluoride is also a big issue, especially here in Brazil, because there are people who love fluoride and people who hate fluoride. And this is a manifest from International Academy of Oral Medicine Toxicology, showing more than 500 articles against fluoride and showing how it's very bad for our health. So if you would to take this picture, it goes straight to the article. Maybe it goes to in Portuguese, but you can change for many languages. International Academy of Oral Medicine Toxicology, it is the oldest association in biological dentistry and homotoxicology in America. Another thing, it is about amalgam. So they have a manifest showing now it's more than 1,000 articles, okay? And it's growing up every day, showing how mercury is very harmful to our system. So I made this movie based on IOMT studies to explain a little bit what happens with the mercury in our mouth, okay? If you cannot see, please let me know, okay? So to remove the amalgam filling, it must be in a safe way. What does it mean? We have to protect our patient before, during the procedure, and after the procedure. So I'm going to explain a little bit, okay? But this is a case where we removed in a safe way and make aesthetic and functional filling with a known BPA filling, composite filling, okay? So this is how we protect ourselves with mask, with those protections, and our patient, he is here. So here we have to remove air and the small pieces of amalgams that it goes outside in a container with chlorella, coal, and spirulina, zeolite, and others. And here we do more or less like that. We also use to the patient oxygen protection to avoid to breathing the mercury. And definitely we have many protections inside the mouth. Based on this physical, so if I don't have the same vibration, it won't vibrate. When I do have the same vibration, it will vibrate without vibration. This is resonance, okay? When I put my amalgam here under my burr, when I begin to remove the mercury, I'm going to vibe in our system mercury. Because that we need to make a safe removal, giving many supplements to our patients before, like magnesium, vitamins B, vitamin C and E, NAC, any acetylcysteine. We must effort our liver, our knees, and we have a protocol that we can individualize for our patients with a tool called bioresonance or even a muscle test, okay? Here we use to individualize, especially by a muscle test, the anesthesia, the shots we can do to the patient, what kind of composite we are going to place, and many other things. So based on these biophysical, this physical, when we can reach the resonance of the glass, we can explode them. And when can we explode them, we can also do it when we discover what is the membrane frequency of a pathogen like a worm. We can also to explode them without damaging our brain system. So we have many technology for that, and in my opinion, it's going to be the future. Vibrational medicine, okay, where we can also unlink the metals. So we have here for the teeth, but it's very important to kill, but also to remove the cow, to remove the virus and bacteria out. Otherwise, they can grow up again. So we use that, but we also treat them in a biological way, okay? So those are my contacts. This is my personal mobile in case you have any doubt, would like to share something with me, it's going to be a pleasure. I love to learn. This is my first contact with India, and I'm pretty happy with it. Here we have also to contact for mentoring and courses and to see patients. We see patients all over the world. Do we have a little more time to show some other slides?
Yes, sir. We have 10-15 minutes more.
How many?
15 minutes. 10 to
15 minutes.
Yeah.
Okay.
Possible
I would
to show?
take some minutes if someone wants to make some question, okay? But I'm going to show some new technologies, okay? Okay, so this is a tomography that we use to see inside the bone and inside the tooth to see the collateral and secondary canals. This is a micro intraoral camera where we can see cavities, especially prostheses that adapted, or gingivitis, or any kind of feeling of tooth break. We used to work with a dark field microscopy. With a dark field microscope, you can see the behavior of our blood. It will be similar to our ground, our biological terrain. So with a drop of blood, we can see. And we've been making a lot of tests. So when we remove the periodontitis, the cavitations, we see the blood much more fluid. When we give back some vitamins, the blood goes better. The blood tells us a lot about the patient. With this microscope, we can see inside the tooth to see if we can see the secondary or collateral canals. We use also for periodontitis, better diagnostic, and many other things. So it's very new technology. It's very good to the end of our work. We also have a series. This is a CAD/CAM system where we make the scanner of the tooth after preparation, and it drills. So it goes to the oven, make the painting, and it goes straight to the mouth to our patient. This is an erbium YAG laser. What it will, it's very used to inside the tooth to clean up the canal, inside the bone to clean up the cavitation, periodontitis, and also to snoring and apnea. We have here a part that it vibes a lot. So we use it for 6 times to make more collagen on it and to decrease this apnea. We also work with the terrain, so we clean up the people's terrain, biological terrain, removing the metals, making them warming, with a nutritionist individualizing the diet, and making the dentistry remove from the inflammatory factors. We do something pretty new, so we take the frequency of something, and we can pass to the prosthesis, to the composite, to the PRF. And with this information, we can make the organ better. We also work with ozone. Ozone is very important, and the literature is showing a lot of good results with it. So this is a kind of height, it's a frequency too. So we saw that we can unlink metals and we can break the membrane of virus, fungus, and bacteria. This is a electrophoresis made by our feet that will do the same. Okay, so I think it's okay. This is the mercury that I told you. Sometimes the mercury released by the amalgams or a shot, a vaccine, or fish, it goes straight inside to our cells by a protein or an enzyme, and it goes to our mitochondria, stopping the energy of our mitochondria, stopping the energy in our cells, stopping the energy in our tissue, stopping the energy in our organs. So mercury is very harmful, and it's very important to remove it by homeopathics. Homeopathic is also like frequency that it will work very good to remove all these things. So using all those tools, I know the patient's going to be, it's going to have the better result. Okay, I'd like to know if you have any doubts that I'd like to make any questions.
Thank you so much. Actually, the class you have taken here is very informative, and many of us don't know about the things that you have mentioned here. Maybe the dentists, they might have idea. I don't know many things that you have shown here. Anyway, Dr. Binoy has some questions. Dr. Binoy, you can unmute yourself and ask the question directly. You have.
Hi, doctor. It was a very informative and very, very insightful session, and all these pathological relations between um, tooth infections and the one you are currently sharing, the mercury, and it can impact our mitochondria and the cell energy. So it's very, very insightful and very learning for us. And thank you for the great session. I have one question. If a person has a tooth fracture and associated infection, does it can cause any cardiovascular issues like cardiomyopathy? Do you have any insight on that?
Every time you have a fracture, we might have also infection. So inside the tooth, there is the root canal, and the nerve, it doesn't like the bacteria. So whenever they are there, they might be dead, you know. Once the nerve is dead, they begin to be a food for bacteria, virus, and fungus. And our system begins to make inflammation beside it. Those inflammation might be an interfered field for the information which is coming from our brain to our organs. And let's imagine we are having a digestion in our stomach. So we have many opening and close valves and movement and releasing acid, releasing the pepsine enzyme. So if it is this tooth related to esophagus, stomach, thyroid, or breast, we might have, with the time, a decrease of inflammation of those organs. And with the time, we might have also a problem. But I think you're asking if the tooth can make an infection. Yes, it can, especially in another places. When we have very close here, very close our gingivitis, our gum, and the gum, it's a lot of blood, that can go for our lungs, to our kidneys, to our brain, our heart. So it can damage pretty much our health. One tooth. Many bacteria from our mouth are also meet in our Alzheimer and many problems like Poriformonas gingivalis, Entomoeba gingivalis, cytomegalovirus. All of those are hidden in our mouth, Epstein-Barr, and many others. I don't know if I could answer your question, Professor.
You did. It is very, very detailed answer, actually. Thank you. Thank you very much.
Thank you, Dr. Binoy, and thank you, Dr. Danesh has come. Dr. Danesh, you have any question?
Yes,
And I have one question. So if those who have put mercury filling, they have to change that filling to ceramic?
For me, about ceramic?
Those who put the mercury filling already have to remove that for the same.
Mercury fillings, yeah. The mercury fillings are 50% of mercury, and the mercury is very harmful. And it's releasing pretty slowly in our mouth. And there are people who love amalgam fillings and people who hate. So we hate mercury at all. So all the fillings of mercury, they should be removed in a safe way. But this is a big issue for the dentist and also for the patient, because it lasts pretty much the fillings of amalgams, but it's not good for our health. As I told you, it goes slowly. It's related to cancer, to Alzheimer, to Parkinson, arthritis, to many diseases, sclerosis. It's with many diseases, so it's not good. So the mercury must be removed in a safe way and place, if it's small cavity, we can place composite of composite BPA free, okay, bisphenol free. And when it's big, we can place ceramic inlays, overlays, or even crowns.
Okay.
Have I understood your question?
Yes, yes, sir.
No? Yeah,
Yes.
okay.
Thank you so much. And I'm inviting Dr. Danesh. No, it is Dr. Danesh. Yeah.
yes. Thank you, Dr. Ajni and Dr. Rodrigo Venticinque. It's really a very good session. Doctor, I would like to ask you a question. What's your opinion on implantation? Because a lot of people are doing implants here, and whether it is a good sign or a bad sign to go for that. Dental implants. Yes, dental implants.
Okay. First, I'd like to thank you for the invitation. Thank you very much.
Yes.
Okay. Implants, they are very important. Once we lose the tooth, we stop sending the information to our brain. Let me go again here in the first slides. So there are many, can you see? Here,
yes.
We have here. We have sensitivity and stimulation here. When we lose the tooth, it's important to keep making the stimulus because this goes to our brain. There are studies showing to us when we lose the tooth, we lose the stimulus and our brain, it goes, the brain, a part of it goes away. In the future can favorite problems of cognition. So it's very important to place again the tooth, okay? Implant, it is the best way. But by this day, we are not using titanium implants, but zircon implants. So zircon implants are more biological. Why? Because sometimes the implant there is aluminum, titanium, and other metals, and it can work as like, do you know when we have we need to remove the thunder and the, sorry, I forgot the name. When you have the flash, thunder and flash, and we call raio. When we want to neutralize this thunder, okay, this in a storm we have the flash and the thunder, right? And when we want to neutralize it, we put a piece of metal inside the ground, right? So this will also capture the energy, and this can also be interference field in the future, like we are showing here. So if we have an interference field changing electrons with another metal or changing electrons with the ground, this will be an interference field, and with the time can decrease the information to our breast, esophagus, thyroid, stomach, spleen, okay? And with the time, we might have problems too.
Okay, sir.
In my
Sir,
opinion.
our time is not, so we can have another session so that we can go ahead. Dear friends, I would like to inform you that the IMPH is about to celebrate its 2000-day celebration. We are about to inaugurate the same on the 8th of this month at Trivandrum, Kovalam. We have nearly 25 doctors from Western is already there in Kovalam. So it will be a simple meeting, but there will be some scientific presentations also, and we are planning to conduct it on from 10 a.m. to 5 p.m. on this coming Sunday. So there already the registration has started, and we will be closing the registration most probably by tomorrow morning sometimes, and already we have 28 registrations, and then that means already nearly 50 persons have registered for the same, including the foreign doctors. So I hope this is an information. We are planning to conduct the same in a extraordinary way. That is, we will be the first inauguration will be going on in Trivandrum, and we will have a big celebration at Bangalore, most probably in April last. So it will be a 3-month-long schedule for the celebration. So this is from the desk of the team IFBH. Over to Dr. Rajini.
Thank you, Dr. Danesh. Now it is the time to start the Malayalam session. Thank you so much, Dr. Rodrigo, for your informative session, and it gives us very good awareness about the things that you have shared here, many equipments, many treatments. Thank you so much. Come again. And thank you once again on behalf of IFPH and from the bottom of my heart. Thank you all the participants for joining with us. And now we are moving to the Malayalam session. I am inviting Dr. Mariamma John for moderating Malayalam session. Good night, everyone. See you the same time. And remember, don't forget about our 2000 celebration. Please join. We'll meet there. Bye-bye.